Dan Agolo, you deserve special recognition, as does Gail Wagner, the founder of the board of TIBA, and congratulations to everyone on the 20th anniversary of what you have done here. Congratulations. Now, there's a few reasons that I am very excited to be with you to celebrate the opening of the operating theater and the ICU. First and foremost, this facility will help expand access to top quality medical care to thousands of Kenyans in the region, not just in this county. This will draw from many of the Lake counties. And it's an important step forward in the work to improve lives every day. Now, second, and a little bit more personal, Trina Spear and Heather Hassan, who you met earlier, are two of the leading innovators in the American healthcare system. Many of you probably don't quite understand. These are two of the most dynamic, most admired young female entrepreneurs in the United States of America. And I'm lucky to call both of them my friend. And I know them because of the business that they founded in the United States. And when Trina called me and told me about her work here and the FIG's work here and said, would you ever come to the opening of the operating theater? I said, fantastic, I have to be here. And I'm delighted to spend time in this amazing county with Trina and Heather and all of you. And I'm excited to be here. This is my first trip to Siaya, and it's my first trip this year outside of Nairobi. So congratulations on this brand new operating theater and everything you're doing. Third, and the point I want to spend a little bit more time on, I'm excited to be here because the project at Matibabu Hospital demonstrates the power of partnership, something that now you know I talk all about, and I talk about it to my team at the embassy every day. And this project demonstrates what we can accomplish when we bring together Kenyan organizations, county-level governments, the U.S. private sector, U.S. government programs, philanthropists, and community leaders. It is really the power of many. What we can do together, none of us can do alone. And I think it's so important to remember that we have to work together for a common purpose. And the old, everyone knows this quote, if you want to go fast, you go alone. If you want to go far, you go together. And this is a very good reminder. If you want to go far, you go together. Now, access to quality health care is a foundation for a strong and thriving community. At the U.S. Embassy, we're proud to work with Kenyan leaders who are prioritizing the health of Kenyans. The success of this hospital is made possible by the amazing doctors, nurses, and other medical professionals who work every day to provide excellent quality care to patients. The directors here have also created a model for training future healthcare leaders. I heard earlier today that the college has achieved a 100% pass rate on the Kenyan Nursing Council exam, which is an amazing achievement. Let's take a moment to congratulate the college and its talented nurses who 100% passed exam. The support of the county governments is also crucial to this success. As you all know, this is Cervical Cancer Awareness Month, and many First Ladies have been integral to the joint effort to develop awareness of cervical cancer. And this initiative is protecting women's lives, which in turn help create families and communities. So thank you to the First Ladies for your important leadership. Working side by side with Kenyans here are several American individuals and foundations who are committed to a partnership that empowers Kenya to improve healthcare in the region. These partners include doctors from Kaiser Permanente, 3 of whom are here today, dozens of volunteers from the TIBA Foundation, and the company FIGS, which provides a grant, which, as you all know, provided the main grant to expand the operating facility and the ICU. These partnerships between private U.S. citizens and organizations and their Kenyan counterparts are the foundation of our two countries' strong relationship. And it's an honor to be invited to be part of the partnership that you have built. We're also proud that the U.S. government has been able to join you in these efforts. Through PEPFAR and the CDC, the U.S. has worked closely with the hospital to cut HIV infection rates in half in this area. Separately, we partnered with the County Department of Health to provide supplies and training to healthcare workers across the county. When the Embassy looks for partners, we look for people and organizations who are committed to innovation and impact, and we have found those two factors right here in Siaya. So thank you to the governor. So let me close by saying how impressive this new project is and how grateful I am for the example that you set through this partnership. Thank you for this important work, and thank you for inviting me to your county.
When you have a common interest and you're positive about it, great things can come in the end, and this is the result. And Ambassador, this was the capital of Siaya, this little town, and the national government decided at that time that we go to Siaya. So nobody ever thought that something will come out of this community. And now probably the best institution, and we're going to ask all our people in the health sector to come here and see how you do a proper theater. And that proper theater is here in Okwala, not in Siaya or in Nairobi. I want to thank you, Gail, and the FIGS directors for what you have done. It's so wonderful, and I cannot, express our gratitude for bringing all this here. And I know this town, Okwala, will grow because of Matibabu. It will become a city because of Matibabu. Now, I want to thank the ambassador for coming here. Your coming here, cements what was started. Ambassador, I hope that the discussions we had, we're going to continue. FIGS is basically in the health sector, but the American government is helping this community and the county as a whole in many areas of in the health sector. We've got a big, huge disease burden: malaria, HIV, and cancer. I think with working with you together, we're going to improve our health situation in the county. And also in the agricultural sector, we had discussions, because with people who are well fed and with water, I think we can do a lot better than we are doing. Now, for the people who have come here, you see what has been done by two dreamers, Dan and Gail. And it has turned out to be such a wonderful institution. I hope you are also going to be dreamers, but have realistic dreams. And don't dream too much. Wake up and do something so that we can have another Matibabu.